Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. Today we are going to be discussing Alzheimer's. November is the month for Alzheimer's awareness, and I'm going to be joined today by Dr. Hamada Hamid. I just want to first, though, talk a little bit about some facts regarding Alzheimer's. Of the 5.3 million Americans who have Alzheimer's, an estimated 5.1 million people are age 65 and older, and approximately 200,000 of those individuals are under the age of 65 who have a younger onset of Alzheimer's. Almost 2/3 of Americans with Alzheimer's are women. And of the 5.1 million people who are 65 and older with Alzheimer's in the United States, 3.2 million are women and 1.9 million are men. Although there are more non-Hispanic whites with Alzheimer's and other dementias than people of other racial or ethnic groups in the United States, older African Americans and Hispanics are more likely than older whites to have Alzheimer's and other dementias. In 2015, an estimated 700,000 people in the United States aged 65 and older will die of Alzheimer's. What that means is in direct cost to the American society, caring for those with Alzheimer's, it estimates about $226 billion, with half those costs being taken care of by Medicare. Today I'm being joined by Dr. Hamada Hamid Al-Talib, who is an assistant professor at Yale University, where he co-directs the VA Connecticut Healthcare Neurobehavioral Clinic. He is board certified in neurology, psychiatry, and behavioral neurology, which is the primary subspecialty that manages people with Alzheimer's disease. He regularly evaluates and manages people with Alzheimer's disease and other dementias. Please join me in welcoming Dr. Hamid. Welcome.
Thank you.
Assalamu alaikum. How are you? So let's get started. What is Alzheimer's disease?
Sure. So Alzheimer's disease is a type of dementia, which means it's a progressive disease. We call it degenerative disease, that it gets worse with time. A dementia, by definition, is when memory gets worse over time and doesn't get better. So it's progressive and it only gets worse. Alzheimer's is one type of dementia. There's several other types of dementia. And so the main features of Alzheimer's is that you have memory loss. You can have problems with thinking, with language, and with behavioral changes, how you process emotions. And in some degree, a person's personality seems to change over time.
And so what are some of the effects of Alzheimer's? I mean, you mentioned like the personality could change. I know that today, the day that we're actually taping, today they are highlighting the PBA, the pseudobulbar effect. That's one of the effects, right?
Sure, so that could be an effect. So pseudobulbar affect is an interesting symptom. It's an interesting symptom that some people experience, where a person laughs and cries uncontrollably, and it's not one of the more common symptoms of Alzheimer's, but you can certainly see that. Probably the most important feature of Alzheimer's disease, as is well known in popular culture, is the memory loss. Mm-hmm. And the type of memory loss that occurs with Alzheimer's disease is short-term memory. So learning new information. So people tend to remember old information, like what happened in childhood, names of people, particularly in the beginning of the disease. Mm-hmm. As the disease progresses, then the ability to learn new information and the more recent information that people store in their brain is more difficult to retrieve. Mm-hmm. So that's the primary feature of Alzheimer's disease. But as it progresses, people lose other parts of their brain function, such as planning movements. So mm-hmm. a common test we do in the clinic or at the bedside is we ask a person, for instance, how do you use a hammer? And hopefully, you and I would be able to kind of manually show, because we can plan it in our brain and we can picture and imagine it and do the sequences of movements that demonstrates how you use a hammer. Whereas in people with Alzheimer's can't plan those motor sequences. That's more in the moderate to severe Alzheimer's. Another feature, which really isn't memory, but is more spatial, relational processing, is people get lost. And so we all lose our keys sometimes. Sometimes when we drive, we forget how do we get to our place because we're distracted either by our thoughts or by daydreaming. But people with Alzheimer's disease very frequently get lost in places they really shouldn't get lost. So that's another common feature. It happens pretty early on. And as it progresses, then you see other disturbing behaviors, particularly disturbing to the caregivers and family members, where they get paranoid, they accuse their spouses of stealing from them or cheating on them. They often can get depressed or anxious or agitated. So these are all symptoms that occurs with Alzheimer's disease.
And so, given that these things happen, what causes it?
Right, so that's kind of the billion-dollar question, so to speak, literally, because a lot of people are doing important research in this field. I think it was the 2000s that people talked about the decade of the brain, and a lot of resources are being placed into understanding what causes Alzheimer's. The predominant theory right now is that, and I want to kind of try to make it in a way that people can understand. I'm not going to go too deep into the science. But you can imagine that the body is always consuming energy and processing energy and building proteins, building networks in their brain, and building various things. And they have to recycle proteins or recycle material. Now, when some proteins don't get recycled or cleared properly, a very specific type of protein starts to accumulate and build up. And it starts building up first in the back of the brain, as well as in the part of the brain called the hippocampus, which is responsible for downloading memories. And then it starts to spread throughout the brain. And those proteins are called amyloid plaques. Those plaques build up and causes, we think, is what causes Alzheimer's. And there's another kind of protein that people have also think might contribute to Alzheimer's called Neurofibrillary Tangles. There's many kind of websites. You go to the Alzheimer's Association website, for instance. They have a nice brain tour that describes and shows pictures that's understandable to a person that doesn't have a medical background. But that's the bottom line: is that these protein buildups. This protein that's supposed to be cleared builds up in the brain and takes over the brain, and the reaction of the brain is such that it starts to shrivel. And if you look at a picture of the brain with and without Alzheimer's disease, you'll notice that the brain with Alzheimer's disease is shrunken. It has many gaps in the brain, and it's quite noticeable the effect of these proteins of this disease on the brain.
Yes, so the key words are plaques and tangles, it sounds like. We recently did an episode on the psychology of pregnancy and prenatal care, and we kind of touched on the importance of stress during that period and how that affects the brain within the womb, right? And the neurons and that connectivity that you're talking about. And it sounds very similar in that how the stress would affect those not developing or the development being cut short. Is that a very similar phenomenon, do you think?
Certainly people have looked into stress and the role of stress in brain pathology. And it's interesting in the sense that we know that when people are overwhelmed by stress, I mean, obviously we all function with stress. We have to deal with stress. That's such as life. But sometimes when we're overwhelmed with stress or have difficulty coping with stress, our stress hormones can be chronically elevated. And so oftentimes what I explain to people is when you're faced with a extreme stress, let's give an extreme example as you're about to get into a car crash, or you get into a car crash, and your eyes, your pupils dilate, your heart rate goes up, you start to sweat, and your nervous system is activated. It's called the sympathetic response. And your stress hormone goes up, and once you're out of that danger zone, or kind of out of that situation, comes back down again. Well, people with chronic stress has shown that if your stress hormones are elevated for a very long time, and we're talking about weeks or months, that actually can cause some of the brain, and interestingly, some of the same brain regions, as I mentioned earlier, the hippocampus, which is responsible for downloading memory, it can also shrink. So we see that in people who are younger people who have depression. We see that in people with PTSD, post-traumatic stress disorder. The hippocampus is actually shrunk compared to people who are relatively more healthy. So there are parallels, and there might be that common mechanism in terms of impact on the brain. But certainly Alzheimer's is a very specific disease in which these, as you said, amyloid plaques and neurofibrillary tangles accumulates in the brain. So it's more than just overwhelming stress. It's actually a disease process.
So when we think particularly about Alzheimer's and the symptoms associated with it, if you're, a person who's not a clinician, just a general audience member who might be watching, what are some symptoms to look for that would signal, I probably should go to the doctor and see about this?
Sure. So I think it's tricky. Alzheimer's is tricky because we all have memory lapses. We all forget our keys sometimes. We all we may lose our wallets or can't find our cell phones, so forth and so on. And if we're getting older, and we all have, with age, some change that occurs in terms of our speed in which we process information. And quite frankly, our lives are so busy and we're so overwhelmed with multiple stimuli. We're often trying to multitask. And that multitasking, which the brain, by the way, is not very good at, makes us more distracted and makes us more likely to lose and forget things. And so the main feature for Alzheimer's is progressive memory loss. So, if you're having more than usual, more than expected memory problems, particularly getting lost, particularly remembering people's names, words that, again, this happens to normal people, to people who are, I should say, healthy people, who don't have Alzheimer's disease. They have a word that they want to express, and it's at the tip of their tongue, and they can't seem to retrieve that word. That happens more frequently than not. Then you should, perhaps you should be checked out. Now, the number one risk factor for Alzheimer's disease is age, and so it's particularly more common as you get older. Once you hit 60, your risk increases, and every 5 to 10 years thereafter it increases. This is a function of age. So obviously, if your memory seems to be going downhill and you're older, this may be something you should consider exploring. Certainly, if you have a family history of Alzheimer's disease, particularly if you have many family members who had Alzheimer's disease at an early age, then it's worth perhaps you should have a lower threshold of seeking help or assistance to diagnose and make sure that you don't have Alzheimer's disease.
So it sounds almost like, rather than a self-assessment, the loved ones around you would be better able to assess that, well, something's going on with my loved one, then maybe they should be checked out. I mean, in terms of their memory and that sort of thing. Sure.
So, it's an interesting question. So certainly, oftentimes, our loved ones, people who are around us, can be perhaps more objective in noticing things such as depression, agitation, which can be signs of Alzheimer's disease, and memory loss. And they have that kind of hopefully long-term perspective to see if you have declined over years. They would notice it. So certainly the caregivers, if your loved one is noticing these things, you should take it seriously. Along the same lines, what's one thing that's interesting about Alzheimer's, especially when you have moderate Alzheimer's disease, is the same regions of your brain that processes your self-perception is affected. So oftentimes you'll see that people with moderate Alzheimer's disease who clearly have memory problems, who clearly forget names, and they fail simple tests of remembering word lists, they have no insight to their memory, or they're in denial of it. And it's not so much because they're just psychologically in denial, it's because they don't have the ability to have that insight.
Yeah. Well, this is very interesting, and I want to continue with you, but we have to take a short break for our sponsor, and we'll be right back.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
So let's get started back. I want to talk to you and switch gears a little bit and talk to you about the treatments for Alzheimer's. What are some of the treatments for Alzheimer's?
Sure. In terms of medical treatments, the main class of medications are called acetylcholinesterase inhibitors, which is a class of medication that increases one of the chemicals in the brain that's important in memory. Now, unfortunately, this class of medications, probably the most famous one is Aricept. Unfortunately, it doesn't slow down. It doesn't reverse Alzheimer's. It doesn't cure Alzheimer's. It simply slows down the decline of the disease. There's other medications as well that can also be used. For instance, Namenda it has similar mechanisms, although it works on different chemicals that's thought to harm the brain. So it inhibits some of the chemicals that's thought to harm the brain. But again, the effect of these medications is it doesn't cure the disease. For instance, if you think about antibiotics with bacterial infections, you take an antibiotic, the bacteria goes away, and you move on. These medications, unfortunately, don't cure the disease in that way. It just simply slows down the progression.
Yeah, it's a really good point because it, from what I understand, right, to clarify it sort of stops or attempts to stop the progression, but it won't reverse it, is what you're saying.
Yeah, so I wouldn't even. I wish it would stop the progression. Unfortunately, it doesn't even stop the progression. It slows down the progression. So if you think of the decline of a person being like this,
right.
It shifts it like this. So it's still going to be decline, but it's not as sharp of a decline. I think there's a lot of work being done, and we're very, very close to getting a medication that actually stops the progression of disease. But right now, many of the studies that have been worked on show that the medications either are not, they don't have tolerable side effects profiles, or they're just dangerous, and so there's just not really time for prime time yet. I think we're very close. It's probably going to happen in our lifetime, but we have to wait and see.
So are medications the only type of treatments that they have right now for Alzheimer's, or are there alternative treatments? Is it just pretty much medication?
Right, so that's a good question. So there are other interventions we can certainly engage in or participate in to help slow down or prevent the development of Alzheimer's. For instance, people, it's well described, it's well established that exercise, particularly cardiovascular exercise, decreases the risk of Alzheimer's, or at least exercise is associated with less prevalence of Alzheimer's disease. People who engage more intellectually, do crossword puzzles, read, have a lower risk of developing Alzheimer's disease. Socializing, socializing with friends, neighbors, so forth and so on, also is associated with decreased risk. So engaging the brain seems to help. Now, there is a market out there for kind of computer games that make a claim of, well, you pay a lot of money for these games, and with the idea that it's going to strengthen your memory and perhaps decrease the risk for Alzheimer's. That hasn't panned out yet. I mean, the jury's still out. I can't say it doesn't work, but I can't say it does work yet.
There hasn't been enough time, probably, right, to study that, maybe?
Right. They need a lot of time and people to study that.
And so, apart from what you've mentioned, are there any other preventative steps that people can take?
Those are the main ones.
Okay. And before I move on to the next question, I want to ask you, because I think oftentimes when you talk to people in the general public, they get confused between Alzheimer's and Parkinson's disease. And I was wondering if you could help people distinguish between those two. Like, what's the major factor that distinguishes those two?
Sure. So Parkinson's disease is primarily a motor problem. So you think of Muhammad Ali, Michael J. Fox are kind of famous people with Parkinson's disease. They don't have a typical Parkinson's disease because Michael J. Fox had it at a very young age. Muhammad Ali had it, we think, due to boxing. It's primarily a motor disease where people have a tremor, are rigid, can lose balance, and have problem. When it progresses at a later stage, may even have problems speaking. It turns out there's other symptoms aside from the motor symptoms with Parkinson's disease, in terms of their digestive system is affected. Oftentimes their mood is affected as well. But it's not a dementia. So Alzheimer's disease is a dementia. Now, a small subset of people with Parkinson's disease do develop a dementia as well. But Parkinson's disease itself is primarily a motor disease, while Alzheimer's is a dementia. In fact, Alzheimer's disease is the most common dementia in the world.
Great, thank you for clarifying that, because I think a lot of times people get confused between the two, but it sounds like there's a very distinct difference between Parkinson's looking more physical in nature and then Alzheimer's being about the mind.
Right. And it's worth mentioning there's other types of dementias. I mean, I mentioned there's Parkinson's type of dementia, but that's only a subset of people. People can develop what we call stroke dementia, where people have multiple small strokes. It can look like Alzheimer's disease, but it's really small strokes that's causing the memory problems. And there's other less common types of dementias that cause memory problems as well.
And we would call those, what, TIAs? Is that what you're referring to?
So TIAs stands for Transient Ischemic Attacks, and those are small strokes that at least the sign of the stroke, it reverses within 24 hours. So if you had a small stroke that caused you to have impaired speech, within 24 hours your speech will come back. What I'm talking about, you can have a full stroke or even several TIAs that affects the part of the brain that processes memory. And so your memory kind of declines with every small stroke.
Mm-hmm. Yeah, that's important to know. So transitioning a little bit, are there resources within the Muslim community to assist people who have concerns about Alzheimer's?
So, there's not, as far as I know, specific research in the Muslim community that is specific to the Muslim community. However, there are a lot of excellent researchers out there, including the Alzheimer's Foundation, Alzheimer's Association, that's very important for the Muslim community to be engaged in. Alzheimer's does not discriminate based on race or religion, and perhaps it does by age, but I really would encourage the Muslim community to be engaged, to volunteer, to contribute. And for full disclosure, I'm not paid by any of these organizations. I don't have stakes in them, except for as a physician, I've seen some of these Alzheimer's organizations play such an important role in educating and supporting, particularly the caregivers who often have the brunt of the burden of taking care of their loved ones. And it can really lead to burnout and be really overwhelming for the caregivers. So there's even a specific term called compassion fatigue, in which a caregiver, after a certain duration, it could be weeks, months, it could be years, really burns out from all that they provide in terms of emotional support, even times physical support for their loved one. And so the organizations such as Alzheimer's Association, so forth and so on, often provides a lot of support and education for caregivers.
Yeah, that's a very good point, because everyone who works in a profession or even as a caregiver to others that has compassion as a part of it needs to do a lot of self-care. And if the caregivers aren't doing self-care for themselves, they absolutely will fatigue. That's a very good point. What are other considerations that you think people should be thinking about around the concern for Alzheimer's, or even if it's like you were mentioning the caregivers? I mean, are there other things that people should be considering?
Sure. So I think a lot of the symptoms that come with Alzheimer's disease, such as depression, such as anxiety, we actually have good modalities of treatment, whether it's psychotherapy or medications. We actually do a pretty good job at treating those symptoms that often come along with Alzheimer's. Rarely people even can hear voices or see things that are not there, but that's something that we do a pretty good job of treating. Another thing I alluded to earlier is sometimes memory problems are not due to Alzheimer's and can be due to a number of other things, and some of those things are preventable or reversible. So for instance, when a person has low thyroid, it can often present itself as with memory problems or depression, and so people might think that their memory problems is due to a dementia, but in fact they have low thyroid, and that can be replenished, and you can come back to being healthy again. And so it would be important to get that evaluation for significant memory problems impairing a person's function.
That's a really good point, because as a therapist, one of the first things that we look at is, has the patient had a medical evaluation? And it's good also for our audience watching, if they go to a therapist, they should have some expectation around the therapist referring them back to see a physician if some of their symptoms seem like they might be related to something else. So that's a really good point, that to have that medical workup and make sure that something else is not affecting them that wouldn't be obvious to the eye. So that's a really good point. And how would you say that, are there any other ways in which you think that this disease affects the caregivers of the people who have it?
Well, it affects them financially, because oftentimes their caregivers if they really overextend themselves, it affects their work. They're not able to work. Obviously, there's direct financial costs, particularly with multiple hospitalizations or visits to the doctor. That's direct costs, but also indirect costs when the person who has Alzheimer's disease can no longer work. It's often a financial burden to the family, and and often it might even affect the work performance of the spouse.
And I know that it's probably a little out of the scope of what you would normally discuss with a patient, but just in our discussion here today, it seems like it might be advisable for people watching to consider making arrangements and, the long-term arrangements, given that there's going to be a decline. What will that eventually look like and play out so that the caregivers and others involved in their lives, whether it be financially or emotionally, don't have to try to figure it all out down the line by themselves. Is that something that you discuss with your patients generally, or just something that they should consider?
Absolutely. I have. So that's an excellent point. That's something that we should have a discussion about with all of our patients long before they're faced with these terminal illnesses, to prepare and think about what their desires are in terms of, for instance, end-of-life care, in terms of end-of-life arrangements, so forth and so on, while they have the capacity to make those decisions and to express themselves. And so that is, in fact, one of the first conversation that I have with the spouse at the time of the diagnosis. And if the diagnosis is made early enough, in other words, the person, the patient that is suffering from the disease has the capacity to make those decisions, then obviously I include them in that discussion. But oftentimes the person that has the diagnosis or the disease of Alzheimer's comes at a later stage and really does not have the capacity to make major decisions. As much as they do have the capacity, we try to address their needs. And of course, the role of the spouse is for them to represent what the preferences of the patient would have been if they had capacity.
Mm-hmm. And so, just while I have you here, I just want to ask you one more question, since we did touch a little bit on the idea that there are other dementias. Is there anything you'd like to say about that?
Sure. So there are many types of dementias. I mentioned a couple of them. The most common, of course, Alzheimer's dementia, that sometimes we call multi-infarct or vascular dementia, where we have strokes or sometimes larger strokes. I mentioned Parkinson's dementia. There's other less common, there's a group of dementias, for instance, that are very much similar to Parkinson's dementia, where you have the movement problems and the dementia, such as Lewy bodies disease or supranuclear palsy. Okay. There's other diseases that are associated with dementia, such as HIV/AIDS. A person can have dementia from that. And alcohol. People can have alcohol-related dementia.
Mm-hmm. Okay, great. Well, I really appreciate you coming on with us today to discuss this very important issue. And I hope that people will take it to heart, and if they know of themselves or a loved one who has these symptoms, go get it checked out. I want to take time now to transition into our fun questions that we always ask our guests. And so I'll start with, who is your Muslim hero, if you have one, and why?
So I'll probably give you the generic answer that you probably hear most of the time, but it would be, probably as an American Muslim growing up in the States, it would probably be Malcolm X, just because that autobiography was transforming for me back in high school. Really made me rethink how I was living and what was I doing in my life. And so he was perhaps the most important American Muslim, and certainly had a huge impact on my life.
Mm-hmm. And what is your favorite concept in Islam, and why?
So I would say, again, this is probably a very common answer you have for your guests, but I would say Rahma, the idea of mercy and forgiveness. It's something that we talk about a lot, but often don't implement and think about. As a shameless plug on my end, I'm the chief editor of the journal Muslim Mental Health, and we're publishing in our upcoming issue a study on the role of mercy and forgiveness in mental health and tempering the impulse to act out revenge fantasies. And so
Very
that's
interesting.
very important concept.
So since you brought it up, how can people access your journal?
Sure. So it's a peer-reviewed academic journal, and it's open access. You can get it for free. It's an academic journal. It's really meant for clinicians and researchers, but anybody can read it. If you just Google Journal of Muslim Mental Health, it'll come up. Or if you go to journalmuslimmentalhealth.com, it'll come up.
And what is your favorite word and why?
So my favorite word, I'd probably say taqwa. I like the qa letter, and so just phonetic, the word taqwa, and of course the meaning, the layers of meaning that has in terms of love and fear and preventing from doing something wrong because of that love and fear you have for God.
Well, that's beautiful. So thank you again for joining us, and it was a pleasure to have you on Muslims and Mental Health, and we look forward to speaking with you sometime in the future again. So thank you. This concludes another episode of Muslims and Mental Health. We look forward to your comments, your questions, your concerns, any feedback that you have. You can send us those at nafshealertherapy@gmail.com. That's NAFSHEALER therapy@gmail.com. And please check out our adjunctive website at nafshealertherapy.wordpress.com for links to different websites and worksheets and even guided imagery that you can listen to for free. And we will also include links to the Alzheimer's Association website and other things that we've discussed here today. So thank you, and please join us again.